If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
Okay, welcome everyone to Health Further. We have a little bit of a different show. I'm flying solo today. Marcus had a pet that he had to put to sleep, which is one of the hardest things really ever to do. I've had several dogs had to put to sleep. So he's working through that. So we have some news to share. It's going to be a little bit of an abbreviated show this week because I won't have the back and forth with Marcus, but I will do my best to go through it, and we will go from there. So let's jump in. Okay, the first story, we'll cover the economy like we always do first, from the Wall Street Journal. Strong crop of earnings eases investors' economic concerns. So corporate profits, it's been earnings season over the last month or so, and the earnings have been much better with more companies, not necessarily healthcare companies, but companies overall meeting earnings or beating the estimates. And then the journal points out, they have a graphic here that I have put up on the screen, that the companies, where the management team mentioned, recession having an effect, came down dramatically. So companies at least are not blaming recession and looking to recession. They're doing well in earnings, and that is supporting, stock market growth, it's come down a little bit, but not at all-time highs, but very high. Moving over to the Fed. So the Fed minutes were released this week, and the article is Fed minutes reveal broad support for holding rates steady last month. This is in the Wall Street Journal. And so it says almost all the Fed officials were in agreement backing the interest rate decision to not cut, even though 2 did vote for a rate cut officially. So I don't know. There's a big conference at Jackson Hole, Wyoming this week. Chairman Powell is going to speak tomorrow. So we're recording on Thursday evening. And of course, I don't know what he's going to say tomorrow. But I think most people are expecting there to be 1 rate cut in September. For a while, there were 2, and then on Polymarket. And then this week, it's been sort of walked back, and it seems like they're leading towards 1. New York Times had a good story. Powell was on the cusp of taking a big gamble with the U.S. economy. I've been on the show for many months, maybe quarters, talking about that there's more of a jobs concern than there is an inflation concern. Powell, I'm not sure, agrees with that. He seems still concerned about inflation. I think we will have a little bit of inflation this fall, but then we're going to have almost all of next year down, disinflation, meaning smaller inflation. Anyway, he will give a speech tomorrow. He's going to try to balance between, the 2 mandates, keeping prices in check while also full employment. Hard to say what he's going to talk about, but I think he's going to sort of, do the typical economist, on one hand this, on the other hand that, and not say that much. But we'll see. So I expect 1 rate cut in September, but it's hard to know what he'll say tomorrow. Of course, when this comes out Saturday, we will have all heard it. Jumping into venture markets. So a British Columbia company, Canadian company in longevity called Molecular U, just raised $5 million to continue its work on finding biomarkers. And so that's positive. It's good to see our Canadian neighbors raising some money. And so there's a lot of longevity companies we're seeing getting funded. The next one is a company called 8 Sleep, raised $100 million. And it's a sleep company. They're going to open up retail stores. They are capitalizing on HHS idea of trying to get all Americans to have a wearable that they track their metrics on. What he told Congress, this is an Axios story about the raise. They're saying it's related, that my vision is for every American to be wearing a wearable within 4 years. That's what Kennedy said to Congress. 8 Sleep has a smart mattress cover. It's not technically a wearable. People lie on it, but it fits within that category. And then they also are working on a FDA clearance for a medical device, one for sleep apnea and another for menopause. So interesting. We have a couple investments ourselves in this track heart rate, respiratory rate, other metrics while you sleep. It's pretty interesting because, of course, you can get compliance much better than other things because people, of course, go to the same bed typically every night, or at least many nights in a week. Okay, from Mobi Health News, Develop Health raised $14.3 million for AI prior authorization platform. This is in the arms race between providers, health systems, sort of gearing up for what they term revenue cycle and trying to get the most reimbursement from the payers. And then on the payer side, they term it prior authorization. It's an arms race. Both sides are gearing up, and I think it's going to continue. But Develop Health raised capital to work on the payer side. It was Series A funding, and A4 Capital and Self-Powered Commons led the round. Also from Axios, Chamath Palihapitiya, probably the best known SPAC. I think he refers to himself as the SPAC King. He has come out with a new SPAC. He did maybe, I don't know, 5 or 6 SPACs, maybe 3 successful and 3 not so successful in the post-pandemic craziness. I think we all agree that we need more public companies, and SPAC is a good vehicle, creative vehicle. Some people are claiming this is a sign that we're at the peak of a bubble. I don't think it is. I think I looked at the terms. Unlike last time, the terms are quite different. Chamath is putting his own value at risk in this case. So typically, the organizer, the team related to a SPAC would get 20% of the raise as their incentive, and that is sort of your benefit for doing that. As long as you acquire something within a year of going public, you were able to gain that incentive. Chamath has made it harder for himself. So he is not going to take, he's not going to not going to vest his shares unless the share price doubles from the IPO price, which is pretty interesting. But then he's taking 30% as opposed to 20. So putting his own value at risk here. And it's kind of interesting. I think, certainly it's much more aligned. And he, has he's good at marketing. So he has a pretty good marketing name for it, American Exceptionalism Acquisition A. So I don't know, we'll see. It'll be interesting to watch if this new structure with putting your sort of incentive pay at risk will have a better effect. Certainly will align interests more. Okay, moving into policy. We had a story in the Wall Street Journal. Leading Pediatrics group recommends COVID-19 shots for young children differing from the CDC. So, of course, HHS and CDC altered their guidance for children. This is the American Academy of Pediatrics, and they're coming out with immunization guidelines that all children ages 6 months through 23 months should get vaccinated. And then if you have people with risk factors in your household, then children who are a little bit older should also get it. Interesting to see the battle between CDC and this, physician group, American Academy of Pediatrics. I think it's not a good thing for our health system to have dueling regulatory bodies, dueling experts. I think it's going to drive more confusion than anything, but that's the state of play we are in policy, unfortunately. So that came out this week. Okay, in Fierce Healthcare, Elevance Health loses Medicare Advantage star rating suit to CMS. So Elevance was arguing that they deserved another higher star ratings, and they lost this case. It's pretty interesting. They scored 3.749695 on one contract. And if they had scored 3.75, which of course is quite close to 3.7496, they would have gotten 4 stars overall. And the judge came back and said that 3.749 is not 3.75, which of course is true, but it's pretty close. So they lost that case, and it's about a $375 million grievance that they did not get. Moving on, CVS got hit with a $289 million fine in a whistleblower case. This is also from Fierce Healthcare. And the court ruled that it was a class action, that they owed money to this group, that CVS Caremark had pushed insurers, including Aetna, where she worked, to submit inflated pharmaceutical claims to the federal government. And so it's a whistleblower case, and they lost that almost $290 million. So CVS continues to have a difficult year. And then United. So United formed a board committee focused on governance. I think this is a good step. It's really United adding strength to their corporate governance. It's unclear if they feel like they need that because there's some oversight problem, or it's sort of preventative or protective. But they're beginning to put things in place in Minnesota. So UnitedHealth Group added this extra committee. That is the payer group. Now we're going to move on to health systems. Emory laid off about 232 people on Wednesday this week. So fairly small layoff. They have about 30,000 employees. But in the Atlanta News First ran an article, former Emory Healthcare employee files a lawsuit after wave of layoffs. And so the lawsuit claims that they didn't follow the proper notice period under the WARN Act. I'm not sure what that is, but they didn't give the 60 days advance notice. They laid people off with very little notice. And so they're being sued for that. It's hard to tell. I think that WARN Act only works if it's a mass layoff. And I think there's some question about, is this number of people, does it justify being called a mass layoff? Of course, 230 people out of 30,000 would not be that. But there is a claim that it was a significant portion of, I think, one department in Emory. And so there'll be a debate over that. Either way, a sign of the times where another health system is laying off folks. Fierce Healthcare, this Mass General Brigham's. So up in Boston now, health system, really great health system in Boston, despite a stronger Q3 in operations, their operations were down $44 million across the 9 months. And this was due to one-time costs related to a layoff they did. So the operations are doing well for Mass General, but they did have that one-time expense related to the layoffs. Okay, moving into pharmaceuticals from the Wall Street Journal. The FDA approved Novo Nordisk's Wegovy for liver disease. So Novo was able to get a new application treating fatty liver disease with Wegovy. And so the stock market liked that. Shares were up about 5% when the news came out. Good to see Novo finding new applications after they were getting so much pressure from hims and hers and others in the space. Okay, moving on to About Health and Us. And I found a pretty interesting story in the Wall Street Journal about cancer. So its title is New Reality for Terminal Cancer, Longer Lives with Chronic Uncertainty. So we are making a lot of progress in treating cancer. And I've pulled up, if you're watching this on YouTube, which you should, I have pulled up the graphics on the Wall Street Journal. Estimated people that are still living with cancer, metastatic cancer, after diagnosis has gone up dramatically. So more than 690,000 people are projected to be living with stage 4 or metastatic cancer, between 6 of the most common types: melanoma, breast cancer, bladder cancer, colorectal cancer, prostate cancer, or lung cancer. And so this is great news that the mortality rate is declining dramatically. People are able to live with, some of these are some of the most common cancers. I think really the first one that we saw really turn around was breast cancer, but now all of these, lung, prostate has had incredible turnaround. Colorectal, skin cancer, melanoma, bladder cancer. We are able to find treatments that sort of hold back the cancer, and And the chemotherapy or radiation treatments typically last for a couple of years. Then the cancer will mutate. So it is not for all time. You really have to find another one and another one. So you have uncertainty, but we're making progress. And so that's a great thing that people don't die. But you bring up this chronic living with what will happen in the next 3 months, 6 months, 12 months. So it's a good problem, but a problem that we're now turning to how we deal with the chronic cancer treatment. Moving into our Web3 coverage. So we talked about Circle. It was a huge IPO maybe a month ago or so. And it's been down since then. All the excitement from the IPO kind of wore off. And then this week, the CEO and a group of insiders sold about 10 million shares into the open market in the secondary. And so they raised 1.4 billion selling their own shares. That obviously caused some pressure on the stock. It's down 4% the last 24 hours. And so Circle, that's not a good sign when insiders are selling. It could be that they just have a lot and they're, of course, trying to diversify their holdings. But if it was, really off to the races and doing well, I don't think you'd see them selling 10 million shares. So I have a wait and see approach on Circle. It's going to be true that stable coins, where they hold value, are going to be the way that a lot of transactions happen. It's not clear if there are barriers to entry and if Circle will get, enough of the market to really be justifying the share price. They might, but I'm sort of taking a wait and see approach. And then the insider selling is never great. Okay, this was from TechCrunch. The Texas Attorney General accuses Meta and Character.AI of misleading kids with mental health claims. And so the Texas Attorney General is Ken Paxton. He has launched an investigation to Meta and Character.AI for potentially engaging in deceptive trade practices, including misleading marketing themselves as mental health tools. And so I think this is, one, it's a serious accusation. Two, it is, directly in healthcare and behavioral health. And so there are disclaimers on the websites, both Meta and Character, but maybe not clear enough. And especially for children, it can be confusing. It can be confusing for adults to know, is this safe? And then furthermore, both Meta and Character.AI have a policy of using your data to serve you better content, is what they call it, that also can be translated, I think, as ads. So I think probably good that the Texas Attorney General is looking into it. We'll see what comes of this. Okay. athenahealth, this is in Fierce Healhcare. athenahealth is approaching AI for physician practices as the tech innovation accelerates. So we saw last week, Oracle came out with their AI first EHR. Athena has rolled out their new platform. They're calling it AI native. So, certainly rhymes with AI first. So we're seeing all of the big platforms, of course, Oracle, Athena, two of the biggest. Athena's more in ambulatory practices. And then also Epic. They had their big developer conference this week. It's going on right now. But they unveiled multiple AI solutions inside the Epic EHR. I think it's 160 AI projects, both internally and with partners. So they are really coming out guns blazing, as are Oracle and Athena. So I think we're going to start to see, does it make sense to, Epic particularly talked about ambient scribing as being now just bundled in to the Epic service. That's quite a challenge for the point systems that have raised capital and are doing ambient scribing and then plug into Epic. And so we'll have to look. I've been nervous the whole time about, the EHR systems. They control the records. They are sort of the source of billing for health systems. And if they decide to sort of bundle in a package, it could make a point system entire industry subsegment, no longer all that competitive. So we'll see how it plays out. It might not be very good. Sometimes these big platforms try to bundle something, but it may not be good quality. We'll see. I would not want to compete with Epic. Okay, and then Google had their Google event. I forget what they call it. Maybe Google Unveil. And it was a bunch of phones, but they really were showing off their AI. And they have a tool called Magic Q. And I pulled up on YouTube here how it works. I'm not going to play it live, but we'll put a link in the show notes. But if you have a Google Pixel phone, which I do, but most people, probably Apple is still the most common in our listener base. But the Pixel phones, they have this Magic Q feature that Google on the phone itself, so they don't pull your data to the cloud or anywhere that can be shared. It's actually on the device. They have your text messages, your contacts, your calendar, and your email all on the phone. And they're able to sift through that and then pop up. Well, maybe I'll show this one example. Okay, so interesting. They had these couple different examples. It's pretty powerful. Now, I think they're really showing off sort of what the AI can do when you link it together. And the privacy of having it just on your phone and not shared is pretty powerful. So being able to find, in my calendar, where am I eating tonight, and be able to have it ready to send, or know that Gary is actually his dog, and pull up the picture that was being asked for, or a flight. So it seems pretty usable. It's kind of what a lot of what Apple promised with their intelligence that never really manifested. Google, I think, watched that and now is delivering it. So I don't have the Pixel 10. I have an earlier Pixel, but I'm definitely going to get the new version and test it out. I'll report back. Google also announced that Fitbit they're rolling out a new personal health coach on the Fitbit platform. So some people may not recall, but Google bought Fitbit a while back, and it's going to be able to use all of your information on the phone to give you health coaching advice. It's more about workouts and losing weight, sleep, than it is what we would think of healthcare coaching. But interesting. I haven't been able to test it yet, but we'll put a link in the show notes and you can test it out. Okay. Now we have 3 stories about deepfakes. So in the New York Times, Amy Klobuchar, she's the Minnesota senator. She wrote a New York Times opinion piece, what I didn't say about Sydney Sweeney. So she got deepfaked. She and Marsha Blackburn had a Senate Judiciary Committee, and they were talking about all kinds of things in the committee. And then Amy Klobuchar's voice got sort of cobbled together from a bunch of different sentences to have a clip about Sydney Sweeney, which went viral and was crazy, but it was not what she said. And so it's pretty interesting that a U.S. senator is writing kind of a warning piece about how powerful and how scary the deepfake can be. Very realistic. Of course, Amy knew she didn't say that, but it sounded like her, and a lot of people thought it was her. Then we have a story from the Wall Street Journal this week as well. AI is driving a rise in CEO impersonator scams. And so this is a situation where your CEO sends you an email and then is on a Zoom asking you to send money to a vendor abroad. And it looks very realistic. And it looks like the CEO. And then the CFO sends you an email later with the wire instructions. And they are fooling a lot of people. And so the quote in here that I thought was interesting is that a year ago, maybe 1 in 10 security experts had seen one of these. Last year, there were 105,000 deepfake related CEO kind of spoofing attacks. And today, it's like 5 out of 10. So half of the security experts are seeing this in their companies. And so it's just a cautionary tale to really watch out for this and be cautious about anything you see on video or certainly voice. I would, verify it with some, maybe call them back or some way to verify. And then that made me think we should test ourselves. So I found this story in the New York Times. It's from about a month ago. AI videos have never been better. Can you tell what's real? And it's a quiz. There are 10 videos that are you have to decide whether it is AI or not, and they are quite good. So I'm going to play one here. This is a basketball player after a game. Let's see if we can listen to it here. So that's the video, and it is completely AI. Let's see, this person walking, what's he doing? So I think that is real. Nope, it's not. It's AI. So I got half right and half wrong. That was 5 out of 10. They're pretty hard. So it's really, to me, it's difficult to know if something is AI or not. There's no real way unless you verify it through some other means, I think. So sending money or doing anything just based on a video is no longer sufficient. Okay, and then we were going to end with a robotics thing. We'll put in the show notes. There's a new robotics company called Loom, and they have these lamps, which are really cool. It looks like it's a floor lamp, and so it's a 5-foot tall, pole with a light at the top. You really should check out the video. And they light the room. They have two next to a bed, and then you just throw your laundry on the bed, all clean laundry but not folded. The example in the video is a bunch of towels, and the lamps wake up. It's kind of like in Beauty and the Beast. That's actually what they were inspired by. And then it does the folding while you head to work, or you're watching a movie or eating dinner. And so I like the idea that a robot could be kind of hidden in plain sight in a lamp and then do work for you. So interesting new robotics. And so, the technology is a little bit scary with deepfakes, but we're also seeing really cool things like a lamp that can fold your laundry. That is the show for today. Thanks for joining me. I think Marcus will be back next week. But either way, we will bring you the news, and there's a lot going on in healthcare. Thanks for joining.